Hello everyone. Today we will study about the mandibular premolars. Mandibular premolars, often called as enzyma to endodontists because of its different canal configurations. So here are some endodontic considerations which we have to take care while treating this tooth. So tip number 1 is we have to take the second radiograph at an angle of 15 to 45 degree, mesial or distal, so as to accurately diagnose the number of the roots and the canals. Tip number 2, we have to check for the sudden change in the radiographic dentistry at the corner or middle third because it usually indicates that the canal is bifurcated from there. Tip number 3, we have to check about for the presence of the PDL spaces. If there are the presence of the two PDL spaces on one side of the root or the PDL spaces which crossing over the root, it indicates the existence of an accessory canals. Tip number 4, we have to check the size of the access because size and the location of the orifice. Eccentric direction, it usually indicates the presence of the accessory canals. So if there is a single canal, the access is circular. If there are the two canals, the access is oval, and if when there are the three canals, then the access is triangular. Mostly in such cases, the distance of the mesiobuccal to lingual is usually greater as compared to the distance from the distobuccal to the lingual. And tip number 5 is when there is an H-shaped canal configuration. The bigger side is usually indicates the buccal one, and the lingual one, it takes a right angle bend from the buccal canal like this. Okay. So these are the some of the tips or the things which we have to take in consideration while treating such tooth. Hope it helps. Thank you. Stay tuned for more.